Hi, a very good afternoon, everyone. Thank you for joining us for today's webinar, which is our first webinar of this year. My name is Zhihan, a research assistant at SSR. Today, we are pleased to invite Mr. Lim Zhong Hao and Dr. Becky Wong from the Translational Social Research Division of the National Council of Social Service share the quality of life study on children and youth in Singapore. We also have Dr. Xia Lei Hun, SSR's Senior Research Fellow, moderate this session. Before we begin, I'll first make a few announcements. First, we are streaming this webinar on Zoom and recording this session live on our SSR Facebook page. We will be uploading the recording on Facebook after the webinar. By participating in this Zoom webinar, you consent to this recording and for SSR to use it for publicity. You may post and vote for questions via our Pigeonhole link, which I'll send in the Zoom chat. When the Q&A session is open to the floor later, you may also use the raise hand function if you wish to turn on your camera and unmute your microphone to ask your questions directly. However, we will not be taking questions from the Zoom chat and the Facebook option. As we have a limited amount of time for Q&A, we apologize if we are unable to address all questions. Finally, this is an overview of our upcoming seminars and symposium for the first half of this year. Our next seminar is on community involvement in casework interventions by South Central Community FSC on the 1st of March. Also, our 29th March symposium on in-work poverty and the challenges of getting by among the young is open for registration. If you are not on our mailing list, please scan the QR code on the screen to receive regular updates on our upcoming events and training workshops. With that, I will now pass my time over to Zhong Hao. Thank you.
Thank you so much, Zihan, as well as SSR colleagues. A very good afternoon to everyone. I think it is our pleasure here for Becky and myself to be presenting to you on this study. So this study we are presenting to you today is actually it's entitled Understanding the Quality of Life of Children and Youth in Singapore. This is done by us at the National Council of Social Service. Yeah. And we'll be presenting to you the key findings from the research today. Just to give you a little bit more background into the National Council of Social Service, we are actually a statutory board under the Ministry of Social and Family Development, and we are actually the umbrella body for over 500 member social service agencies in Singapore. And so it's our pleasure that we hope to actually bring these findings to you today, in the hope that it may actually inspire some thoughts as to what kind of services you may want to have for your children and youths, and how do we go about to improve their quality of life. To start off, let me give you a bit of context into the Quality of Life Research Series, or QOL, as we call it at NCSS. So the Children and Youth Study, which we are presenting today, is part of the research series on QOL across different population groups. But actually, generally speaking, they all address a simple few questions. Number one, are we really serving our target population needs? How and what should we prioritize and focus on? As well as how do we really make a difference in terms of the well-being of our vulnerable groups. So to this end, actually NCSS has since 2015 conducted a few different quality life studies on different groups. Today our focus is really on the quality life of children and youth. But some of you may also have recalled previously that we have actually presented the QOL of caregivers at SSR earlier last year. Yeah, but today our focus is really just on the children and youth study. So to start off, let me explain a bit more about the children youth study that we did. So this was actually conducted between 2017 and 2019, where NCSS actually went out to administer surveys across different households, schools, hospitals, as well as social services in Singapore. And in total, we surveyed over 10,000 children and youth. There are actually 4 main target groups in this study. So if you look at the left-hand side of this slide, it shows you sampling. Generally, we actually surveyed over 7,000 children and youths who we classify as without conditions, meaning they are without any physical health, chronic illnesses, any mental health conditions or any disabilities. So for this group, we also then applied weights to make them more representative of the overall population. And these are the analyses that we will share with you later on. We also then have about 2,000 samples of children and youth with conditions. So to this, we actually sort into 3 groups based on their primary condition, depending on the service they access and so on. So actually there are 3 groups with conditions. So there are those with chronic illnesses, which includes things like diabetes, asthma, and so on. Those with mental conditions, which includes your depression, anxiety, and other other mood and anxiety disorders. Lastly, those with developmental and special education needs. So this includes persons with your physical disabilities, intellectual disabilities, and so on, as well as special education needs such as dyslexia and ADHD. So we are interested to study their quality of life, and with that, we also have administered several other instruments in this study. So on the right-hand side summarizes the different kind of instruments that we use in our surveys. The first key measure we have is the KID screen. I'll be going later on into more details about it, but suffice to say that it actually looks into the quality of life of different children across their conditions and as well as their ages and so on. We also administered measures looking at their family dynamics, the phases for these app kits that looks into areas of coping with having a health condition for those who have a condition, who does to look at level of functioning, as well as a demographic packet to look into things like the household composition, their schooling level, and so on and so forth. Because of, to be practical about it, because it would have been a very long survey otherwise, we administered, we prioritized measures like the KID screen and faces, which are, this is for family dynamics for children and youth without conditions. And for those with conditions, we prioritize the DSAP kits and who does instruments. And in this survey, because we are actually trying to survey children and youth, for children and youth above 7, so the age range of this study is between age 1 to 18. For those who are 7 years old and above, we encourage the children themselves to actually self-report on their quality of life. But otherwise, for all other ages, actually it will be a proxy report by their caregiver. So the caregiver actually will fill up the other instruments in the questionnaire as well. And the caregivers, for those with conditions, we also use this measure called the Huko breath to actually assess the caregiver's own quality of life. And this will be later on analyzed and used as a correlate for some of our analysis. Yeah, so I hope this gives you a overall picture of the kind of measures that are included in this study. So to go on, I'll then be going more into an overview about what we have found before Becky takes you through some more specific findings for those with conditions as well as those without conditions, as well as the service used, as well as some of the implications that we can draw from the study. Yeah, so going on to the overview. So to really explain more about the KID screen measure that we have used, the KID screen tool actually is something that we use to assess the subjective well-being across different domains of life for children and youth. We find this to be quite a holistic measure. It was first actually validated in the European setting, but has since actually been used internationally, including Asian context as well. So the KID screen measure encompasses 8 different domains, such as physical well-being, psychological well-being, moods and emotions, which are a bit more negative aspects of psychological well-being, autonomy and regulation, financial resources, social support and peers, school environment, as well as social acceptance. So I think based on this, right, as well as the facets that are actually listed in each one, you can actually have a sense that this is actually meant to be a holistic measure of their well-being. It looks into things like their own personal individual psychological state, as well as their relations to their parents, their schools, and their peers, and so on. So it's meant to really be a holistic measure of their well-being. So based on these two, as well as comparison of our own scores for our children and youth with the scores in other studies done in other countries, what we do see for a start is that our quality of life of our children and youth is about average. So we are somewhere in the middle compared to other OECD and Asian countries we have in this scan. Yeah. And next, we also then ran a regression based on our total sample. So we were able to do a regression introducing different individual characteristics, including health status, gender, age, ethnicity, home environment and finances, as well as family factors, to see how this actually correlates with the overall quality of life to begin with. Based on this regression, we found that the significant predictors were actually having a health, not actually having a health or developmental condition, high household income, and actually spending more time with others would be associated with having a positive quality of life. So these are actually some of interesting aspects to which then we pick up on, and later on as we go into further analysis, you can actually also see how that also might potentially interact with other factors as well. Yeah, but this is just to begin with, and I hope this gives you a flavor of the kind of analysis that we can see in this study lah. Yeah. So with that, I think I will then hand on the time to Becky to bring you through the rest of the findings in detail. Yeah, thank you.
Okay, so starting with the findings for children and youth without any health or developmental conditions. So these are children and youth in the general population. And we'll start with the findings for each individual questionnaire measures first, like the KID screen, and then later we'll move on to some modeling approaches that sought to incorporate multiple questionnaire measures in a single model. Okay, so starting with the KID screen measure, the QOL domains are shown in the horizontal axis from physical well-being on the extreme left all the way to social acceptance on the right. Overall, QOL score in each of the domains were good, with the highest scoring domains as moods and emotions and social acceptance. And moving on to the facet level, lowest scoring facets were in the areas of receiving and giving help to their friends and relying on their friends. This is for children and youth without any conditions. We also used a network model approach to understand interconnected relationships between the different questionnaire measures. And this allows us to visualize the structure and patterns of the interconnected relationships. So in the network model, as you see on the left-hand side, the psychological variables are graphically represented as colored circles or nodes, and the edges or lines represent the strength and direction of the relationships. So blue lines represent more positive relationships, and red lines represent more negative relationships. And together, the network model for children and youth without conditions is seen on the right. In pink, there are the demographic factors. In green, the family dynamics variables, and in blue, the quality of life domains. So putting all these variables in the model, it is then possible to identify the most important variables to the model, and these were, there were two of them. One was positive family functioning. This refers to the family's ability to solve problems and spend time together as a unit. And my mouse is over the family functioning domain. Also, psychological well-being, and this refers to the child or youth's positive emotions and them experiencing a sense of fun and enjoyment in their lives. So moving on to findings for children and youth with health or developmental conditions. Again, starting with the KID screen measure, the domains are seen on the horizontal axis, and each of the colored bars represent children and youth with the different health conditions. So in turquoise on the extreme left, those with chronic illnesses. In brown, those with developmental or special educational needs. In gray, those with mental health conditions. And in dark blue, those without any health conditions. The takeaway from this slide is that children with conditions show more needs beyond their specific condition type. So take, for example, children with mental health conditions as shown in the gray bars. Aside from showing lower QOL scores than their peers without conditions and their peers with other condition types in the areas of psychological well-being and moods and emotions, they also showed deficits in areas like physical well-being, autonomy and parent relations, school environment, and social acceptance. This is also true for children and youth with developmental or special educational needs, and they showed lower scores than their peers in areas like social relations and peers, also financial resources. So this highlights to us that the areas of deficit in well-being might extend beyond the specific condition type of the child, and it highlights to us why holistic measurement to QOL or quality of life is important. Aside from the domain level analysis, then we also looked at the specific facets where children and youth with health or developmental conditions showed lower scores in the areas of relying on their friends, receiving and giving help to their friends, and also having enough money to do the same things as their friends. So again, these two facets on receiving and giving help to their friends and relying on their friends is common with that for children and youth without conditions, which we showed earlier. Moving on then to the DCGM tool, the 6 domains are shown on the horizontal axis from independence, which includes the child's level of autonomy in living with their condition, any negative emotions relating to their condition, social inclusion, social exclusion, functional limitation, and any perceived negative emotional impact of taking their medication or medical treatment. On these 6 domains, then children and youth with health or developmental conditions showed lowest DCGM scores in the areas of independence and also social inclusion. We'll come back to this point on social inclusion a little bit later on in this set of slides. Okay, so here we present a network analysis to understand once again the different relationships between 3 groups of factors this time for children and youth with health or developmental conditions. The first group of factors are more static factors. There are demographic factors and also the child's functioning. The second group of factors are shown in green. These are the dynamic factors that perhaps are somewhat modifiable. And here we put in the DCGM domains and also the caregivers QOL domains. And in blue, those are the third group of factors, which are the child or youth QOL domains. Again, we wanted to identify the most important nodes or the most central nodes to the model. And the 3 most important nodes were first, the psychological well-being of children and youth, that's shown or highlighted in yellow. Then also their social inclusion in green. This refers to their feeling competent and accepted by their peers. And thirdly, also the psychological well-being of their caregivers. So again, this idea of a holistic understanding to QOL, not just personal psychological well-being, but also how they're perceived by their peers and the well-being of their caregivers as being important to children and youth with conditions. Again, this point on social inclusion was highlighted when we examined the different DCGM domains and their importance to the quality of life of children and youth. And even after controlling for the child's functioning and also their demographic characteristics, social inclusion came out as the most important factor to the children and youth's quality of life, regardless of their different condition types. So aside from looking at analyses relating to well-being of children and youth with conditions, we also looked at the patterns of service use. Here we have the rankings or ratings according to the most useful services and programs cited by parents and caregivers of children and youth with conditions. And the findings are grouped according to the children's condition type, with chronic illness on the left, with mental health conditions in the middle, and developmental or special educational needs on the right. And overall, parents and caregivers found that the services and that their children had access to be useful. Aside from usefulness ratings, we also looked at the most utilized services and programs, once again grouped according to condition types, and we see that tuition and therapy were among the most utilized services and programs for children and youth with conditions. With regard to the most commonly requested service types, we see that therapy was quite commonly requested among children and youth with various condition types, with barriers as cited as cost of service and also inconvenient location. Finally, we also asked parents and caregivers to rank the relative importance of various areas of their child's well-being. And perhaps unsurprisingly, the top ranked area for improvement for each group of children and youth was most related to their condition. So for those with chronic illnesses, their parents rated physical well-being as an area that they would prioritize resources on. For those with mental health conditions, psychological well-being, and for those with developmental or special educational needs, academic education. Okay, then finally concluding with the implications for children and youth with developmental conditions, we've seen in the slides this emphasis on a holistic or ecosystem approach to understanding the well-being of children and youth beyond their specific condition type, and also this importance of affordable and accessible mental health support and services for children and youth who need it. The point on social inclusion, this was also came across in quite a few of our findings relating to children and youth with conditions. And at a community or societal level, this points to the importance of building awareness and shifting behaviors for more opportunities for children and youth to feel competent and accepted by their peers and community. But also at the individual level, this could take the form of a safe space or conversations to include children and youth with conditions, and just to open up some conversations about their conditions, and including or not limited to mental health conditions. For children and youth without conditions, we noted their highest QL scores were in the areas of social acceptance, and this, looking at the school's landscape, this reaffirms schools' efforts to discourage bullying. However, more could be done in the area of social relations and peers QL, which was where some of the lower scoring facets were found. And this could take the form of providing natural context for children and youth to rely on their friends and to receive and give help to their friends. And finally, for children and youth without conditions, there was the importance of positive family functioning. Last year was the year of celebrating SG families, but beyond this being a national movement for last year, this idea of positive family functioning underscores the importance of families to the well-being of children and youth without conditions. And so our findings point to the continued importance for families to interact and solve problems and spend time together as a unit. So just before we conclude, we want to share the QR codes for today's presentation. There are some more details. If you want more details, you can find them on our public report that was released late last year. But there are also here public reports for the other QL studies that we've conducted, including for caregivers and also our older study for vulnerable adults. Okay, so thank you.
Thank you so much, Zhong Hao and Becky, for your presentation. So before I hand over to Lei Hun, just to answer some questions regarding the report. For this webinar, I will send a follow-up email to all participants, which will contain the link to the NCSS report on quality of life of children and youth. Yep. So just to address this question, and I have also added the link in the Zoom chat for those who wish to access the report now. Right. So without further ado, I'll now hand over to Lei Hun, who will moderate the Q&A. Thank you.
Okay, good afternoon, everyone. I'm Lei Hun from SSR, and I have the privilege to moderate this Q&A sessions for today. So we have over close to 200 attendees today, so I hope we can have a lively interactive sessions with the presenters, since it's a rare opportunities to actually interact directly with the researchers. And so hopefully we can have more questions coming along the way. We have the two alternatives for you to post your question. One on Pigeonhole that you can find the link on the chat. The other option is you can raise your hand, and you can do that by clicking the reaction button at the bottom of your Zoom screen, and then you will be able to find the raise hand function. Okay, so let me start by with one questions on Pigeonhole, which has already received 4 votes. So the question starts with, how do you account for cultural context differences when comparing across countries for things like kids screen? Are there things you add that are more specific to the Singapore context, like schooling and housing? Yeah, presenters?
Okay, yeah, sure. Maybe I can take a question. Yeah, so just to explain a little bit more, I think the kid screen itself was actually developed to be an instrument that could cut across cultures, as well as children and youth across regardless of any social economic status, health condition you may have. So as a result, I think during the development of instrument, the authors did take care to run focus groups and also do different reviews to ensure that first and foremost, the domains that were included in the kid screen would be something that was universal as possible in understanding children youth quality of life. And I think if you look at the items, right, for example, in the school environment domain, which is actually covered by the kid screen, they do ask in a very straightforward, relatively basic and straightforward ways about have you been happy at school? Have you got on well with teachers? So as a result, I think our perspective is that it gives a very relatively fair way of understanding how children and youth across different cultures may potentially feel about a certain issue. Yeah, so I think we do acknowledge that, well, of course, I think different cultures may have different ways of the education context may be different, the systems may be different, but this is really just to give us a broad sense. Ultimately, I agree that I think quality of measurement is also contingent upon the context of a person in their own culture and so on. But however, I think the kid screen itself does help us to be able to measure some of these things in quite a cultural fair manner. Yeah.
Okay, thanks for your answer. For those who would like to have follow-up, please feel free to type in your question as well. Okay, now we'll go on to the next question, which is, may I know how young children are assessed? Do their caregiver complete the survey form for them? Yeah, and actually, I personally have also my own questions that follow from this, because maybe we could get the presenters to clarify this question first.
Yeah, so for the kids screen tool, they have a child self-report measure that has already been developed, and also the proxy measure. And so it's possible to just use what has been developed by the team, the kids screen team. And both these versions have been validated. And shall I go on to maybe I'll let you continue first, Li Hun. Yeah.
Okay. Yeah. So because you have mentioned that the for young children, they basically the caregiver have completed the survey for them, right? So actually, my follow-up question is, what do you think are the limitations, if any, of the data collected from caregivers on behalf of the young children? Yeah, and whether there are any data that might help to supplement or triangulate the findings that is based on this proxy data. Yeah.
Sorry, can you start with your first question again? What are the limitations? Is it about?
Yeah, because the data are actually collected from the caregiver, right, on behalf of these young children. So I wonder whether there could be any possible limitations because of that, especially in view of the fact that the findings of the QOL was a lot more positive for young children than children that are older.
Yeah, okay. So the use of proxy report, right? Like what Song Ha mentioned just now, it is used for young children, but it's also used for children who may not have the cognitive capacity to respond on their own. And this could apply to older children as well. So there are two scenarios in which we may use proxy responses. Limitations, like just now what you mentioned about, okay, so this idea about young children having higher QL, right? Okay, so proxy issue aside first, this trend is actually quite well noted. It is a developmental trend that is noted not just by us, but also international researchers. across the lifespan, it's not uncommon to see a U-shaped pattern of well-being where children score higher, and then in adulthood, well-being goes down, and then in older age, well-being goes up again. But just looking for younger, for children below the age of 18, because that's what we are looking at today, we see that well-being generally declines with age, and this could be due to various factors, proxy report aside. So with this issue of proxy for very young children, the alternative is we may not have any self-report data for them, right, because they are so young. And so studies have looked at the concordance between a proxy report and self-report for children overall. Generally, for well-being studies, while researchers acknowledge that there are some limitations with proxy report, generally reliability and intra-class correlations between proxy and self-report are relatively good. But not just looking at well-being studies, we might be interested in the KidScreen tool specifically, right? Because that's what we are using here in our study that we are presenting today. And in fact, the KidScreen developers find that across European and Asian countries, the score difference between proxy and child scores are it's quite a small difference. Of course, there are some domains that the scores show a larger difference, like the social acceptance domain and also the financial resources domain. So here we see more disparity between proxy and child responses. But generally, still international studies on KidScreen have found good concordance between proxy and child responses. I think there was a second part to your question, but I've forgotten.
Or whether do you collect other data to complement this kind of self-report? Yeah. Or to triangulate kind, yeah.
Yeah, so if you scan the QR code to our report, you will find some FGD data, but our FGD data is more for youth. So youth with incarcerated parents or with different kinds of impairments and their caregivers and how they were coping. But we don't have so much FGD data on young children. Yeah.
Understand.
Yeah.
Thanks for your very detailed explanation, Becky. So maybe I'll now move on to another question, which has also quite a high vote. Okay, the other question that is popular among the audience is, do you use this QOL measure to assess the effectiveness of program policies, example anti-bullying campaign? And do you have plans to do so? Or what can these measures, especially when tracked, be used for? So I think these questions relate to the utility of the QOL measures.
Yeah, I can take this question. Perhaps to just share more generally about NCSS's plans to evaluate programs in the sector. So currently, actually for NCSS administered program, we do have this thing called the sector evaluation framework. But I think the sector evaluation framework really looks into the tracking the matrix and also the performance of programs based on things which are more directly relevant to the program. For example, if let's say it's a counseling program, then we might look at mental health outcomes and so on. So that's a bit more program specific, and I think that will also be more proximal to what to really understanding the differences the program makes. But we do also have an additional layer of QOL measurement on top for the SEF. So actually for programs under the SEF, they will also be actually tracking the QOL of their service users. But we do this more because we recognize that QOL is actually an overall measure of the well-being of the vulnerable individuals we serve, and we are also actually quite interested in that as well, to really understand at the end of the day, across all these different programs that we may fund or we may design, did it really have impact on the well-being of our service users? But yeah, I think so to recognize that actually I think yes, while the KidScreen we may zoom in that there is this bullying domain being measured. I think our purpose of using a KidScreen is really to be as holistic as possible, to really look into well-being across all the different domains of a person's life So as a result, the way we may use the QOL measure in program evaluation may be slightly different. Hope that answers.
Okay. All right, so let's go on to the next question. Do policy division in the government use the QOL study in their decision making or policy making? Programs can only do so much to shift the needle.
Yeah, maybe I can take a question again. Yeah, so I think to be assured that we have been sharing these findings with relevant stakeholders, including in government as well. Some of the findings, for example, we did highlight do affirm certain efforts that ministries like MOE is already trying to design, for example, to raise the peer support, to raise peer support in schools and so on, which is consistent with our findings. And I think overall, I think the QL instruments do also have the utility of really surfacing like where the gaps are for our children and youth, as well as just really doing needs assessment on the ground lah. And we understand that, of course, really we require many helping hands to really have an improvement in many of these areas. So it's actually an effort that will require both the government as well as the community partners to be involved in lah. So I think I hope that by sharing our study today, this is also our attempt at also helping everyone see that there is actually a role for everyone to play. For service provider, these may be some of the areas to which you may want to look into when you are actually already seeing your child for a program, to also perhaps potentially want to explore certain other areas that you don't usually do for your programs as well. Yeah.
Okay, so we now have another question that pertain to the more details about the study. So the question is, could you elaborate on social inclusion and what parameters were considered when assessing this construct?
Yeah, I'll take this one. So social inclusion, we have adapted the items, we have taken the items from the DCGEM domain itself. So there are two items under this domain. One is about whether children feel that they can do things, do most things as well as their friends, and also whether their friends enjoy being with them. So this idea of competence and also acceptance by their peers. And we've tried to highlight this in the model as well. So what was the second part on social inclusion? Sorry. What parameters were considered when assessing this? I guess just these two items. I'm not sure if the person who asked the question wants to elaborate on what kind of parameters. I'm not sure what they are referring to. I hope this answers their question.
Maybe for the person who asked that questions can either raise their hands or type in another questions to clarify what he or she mean. But maybe in the meantime, we can move on to another question. Okay, there's another questions on this is interesting. This study was done 2017 and 2019, which is pre-COVID. And so what is your take of QRL of the children and youth post-COVID? Yeah.
Maybe I can chime in first, then I think if Becky has anything to add on, feel free lah. So I think given that our study was conducted pre-COVID, I think we do not necessarily have some of the data to also really drive at lah. But I think we are actually to also share on some of our plans again. We are actually planning to do a repeat run of this quality life study on children and youth again. That might be sometime in the next 1 or 2 years. So hopefully we will be able to see, of course, aside from COVID, there are a lot of other things that may have happened over the past few years. We are trying to see whether that has had impact on quality of life overall of our vulnerable groups. But otherwise, I think if I was to speculate, I mean, we do hear about, for example, with COVID during circuit breaker, especially, children may not have had a lot of time outdoors. So that may potentially have an impact on their physical well-being, exercise and so on. And I think speaking from my personal experience, I think my nephew also have had a lot of screen time on his digital devices. So I feel those are some of the things that anecdotally we do hear a lot, and I think we will be interested to then track some of these things like and see how they actually may affect the well-being and quality of life of our children and youth as well. Yeah.
Yeah, I think Song made really good points about even when we want to measure or understand children and youth with QL, children and youth well-being during this time, there are so many things that are happening in the landscape along with COVID, and it's hard to just pin it down to what are the factors that drive it. But I'm also thinking of the mental health issues that have surfaced a lot being in our local news for children and youth. And I'm also thinking of home-based learning, how that might have affected their school environment domain during these years, and also their social relations and peers, right? With COVID and them staying at home, there's less chances for social interaction. So yeah, a lot of exciting things to look at, and yeah, just have a look at the international literature as well, and see what are the trends.
Okay, so now we move on to another questions. This question relates to whether financial resources available make a big impact to the QOL of children and youth. Just wonder whether your data will be able to shed light on this.
Yeah, I think just now we had I'm not sure about financial resources, but maybe the participants thinking of household income. So just now we presented a slide on how higher household income per capita is associated with significantly higher quality of life. But actually, this idea of SES, the relationship is a little bit complex. If you look at our report, we do find that it's not a simple relationship. There could be other factors involved, and children and youth coming from households with much higher household income. We say in our report 12,000. We do see that they could go two ways, right? Some of them end up with very good quality of life, and others are in the at-risk group of quality of life. So this relationship between SES or household income is not a straightforward one.
So we have another more technical question, like what is the Chromback alpha of Kidscreen and ACTSG in Singapore? This is to find out the reliability of the international survey in our local context. Yeah. Not sure whether you can manage to dig out this.
Yeah, off the top of my head, Chromback's alpha was acceptable for all the domains, so above 0.7. But at SG, we haven't measured that in this study, so I'm not sure if I'll be able to comment on that.
Yeah, maybe I add on. Yeah, I believe the person who asked this question probably is thinking of our sector evaluation framework because actually it's actually one of the tools. Sorry. She's actually one of the tools that are covered under the framework. But yeah, but it's actually not in this study. However, I think from previous administrations of the ACTSG tool, Chromback alpha is pretty good. It's generally above 0.7. I mean, based on my memory, I think So for some domains where the Chromback alpha is slightly lower, there are reasons for that as well But I think this may not be the platform to comment too much on that, because we want to focus more on the study that we're sharing here today. Yeah, but I think if there's further questions, feel free to write in to NCSS. Yeah.
Okay, now let's move on to questions related more to the implication of the study. So there's these questions on how can these findings lead to better program provision for children from different socio-economic background. Will there be further discussion on this?
So I think as I mentioned earlier on, this study is one of the data points to which we use to engage with different stakeholders. So including like stakeholders such as MSF and MOE. So I think we are all very interested to be using these findings to really explore and develop programs for our vulnerable groups. So I think our study did also touch on, for example, for children and youth with chronic illnesses, with special education needs, and so on. So I think the relevant divisions will be following up on some of this. We'll be interested to look at some of these findings as well. But of course, I think with NCSS, and so social service agencies, I think we all have our own take, we all serve our own client groups, and you know, we all have our own ideas from the study about how we could each make our mark on the landscape. So I think we are happy to always enter discussions if you have any ideas or any reflections after the study as well. Yeah, can feel free write in to us if you need. You know, just would like to check in on certain assumptions or clarifications as well about the study. Yeah, I think we're happy to do that. Thank you.
So far, we have not seen any raised hands. So please feel free to raise your hands, and we hope that we can have you live with us to interact directly with our presenters. Okay, another question also related to implications and findings is for children or youth with mental health condition, are there any findings on the rate of self-harm and potential implications on preventive efforts? Yeah.
We did not collect any data specifically on self-harm, and in fact, for the children and youth with mental health conditions in our sample, the most common conditions that we saw were those with more depression, anxiety type conditions, also a bit of OCD. So we don't have specific data on self-harm, but I guess looking at the QOL domains themselves, maybe just to focus more generally on positive psychological well-being, just going back to our domains on just fostering positive emotions towards their life, their self-esteem, and also addressing the lonely and depressive type of symptoms. Those would be more general recommendations than what the participants asking specifically on self-harm.
Okay. There's another questions that is also have quite high up on the list. Just that maybe there could be some clarification, but here just read out the question. With social inclusion and family functioning being crucial for children's well-being, I would like to ask if the program, these findings are based on focus on these domains.
Yeah, maybe I can comment on that, then Becky can add on if anything. Yeah, so really there is a plethora of programs in the sector, right? And I think everything we do really makes will have an impact eventually on the service user. Yeah, so I think just circling back very briefly to just now the question on self-harm, you know, our study doesn't talk about self-harm, but we know self-harm programs are important as well. Yeah, so I think this study is really just one data point to which we look at when we talk about you know, having programs to serve our children and youth. Having said that, I think we have come up with some examples of how the study does affirm certain programs or certain initiatives. So for instance, as we said earlier on, the MOE example about fostering peer support culture is one of them. But I think specifically to say family functioning, I think actually just last year was MSF's year of celebrating families. And I think that alongside that public education, public awareness kind of thing, there have been resources put into, for instance, really putting out more resources for families. There's a family nexus hub that also then aggregates some of these resources, some of these services for families, yeah, to seek out to potentially improve their family functioning and so on. Yeah, so and I think the other thing about social inclusion, yeah, so there are programs out there that also then seek to address these feelings of you know, for persons with disabilities, for instance, are they able to do the same things as peers in say mainstream schools or peers without conditions? I think all these programs are actually in the sector, and our study to let us affirm that you know, these programs are things which really that would have an impact on the well-being of the service users. Yeah. But I think aside from programs, also I think you can also imagine how outside of the social service program setting, really even individual relationships, how we may interact with children and youth ourselves as adults. All that may also even make a difference at the end of the day. Yeah. So really it's just taking a more holistic lens, I would say. Yeah, and just bearing some of these pointers in mind. Yeah, when we talk about, say, really trying to improve the quality of life of our children and youth out there. Yeah, I hope that answer helps you kind of untangle some of these things a little bit more. Yeah.
Okay. Okay, so there's another query on the findings. So in your report, finding number 2 listed, children and youth who spend more time with their father had a significantly higher quality of life. Can you elaborate more on this?
So the finding on father. So essentially, we collected data on roughly how long the children spend with each of their parents, right, on weekdays and also on weekends. And then we averaged across to get a sense of what's the average time that each parent spends with their child. And so for us, on average, fathers spend about 5 hours per day with their children across our sample, and mothers was about 7 hours. And yeah, so we found that more time, children and youth who spend more time with their fathers had significantly higher quality of life. In our report, we also have described an analysis for children and youth from non-intact families, right? So these are children and youth from families whose parents are not married, so could be divorced, could be separated, could be widowed, and so forth. And so when we ran an analysis on these children and youth, when we included time spent with father into the regression model, family intactness was no longer a significant predictor to their quality of life. So this is our additional analysis for the importance of children and youth spending time with their fathers.
Yeah, I think if I could also add on a comment. I think the utility of this finding also stands out when we talk about, say, families that have experienced divorce. So for families that have experienced divorce, sometimes there is a tussle over who has care and control over the child and so on. But I think what our study finds is that, regardless of what, if the child actually has because I think we have introduced parents with marital status as one of the variables in the regression. We did find that, regardless of that, if you have time spent with fathers, actually that in itself has an impact on the children's quality of life. As a general result, of course, I'm sure there are some cases where it's really better not to have the father there at the moment, for various reasons. Yeah, but I think generally speaking, really points to the importance of fathers being involved in the caregiving role, or really just spending time with the child as well. I think this also squares with a finding on a study that MSF actually presented last year at this conference, at the consortium of Asian Family Conference, where they also found that actually this form of co-parenting families in families that divorced actually result in better outcomes for the child, better behavioral outcomes compared to parallel co-parenting and single parenting. Yeah, so I think this squares very well. I think if I was to comment on more about this finding that we have about time spent with fathers. Yeah.
And I guess just to wrap up this idea about fathers and thinking together of finding on the importance of family functioning for children and youth without conditions, right, in the network model. So I guess we find that this idea of importance of time spent with fathers, how families relate to each other as a unit and they solve problems together. This really underscores the importance of family environment for children and youth.
Okay. And actually, I have related questions to this finding from my SSR colleague. So they wonder whether there are any policy implications that you recommend in relation to this finding.
Yeah, maybe I chime in on this. Yeah, so I mean, we have been working quite closely with the relevant stakeholders from these findings lah. However, of course, I think policy making really is more complex than the findings of one study. I think we do have to also take care to look at the trade-offs whenever we think about what are policies to recommend. some policies may come with various economic costs that maybe at this point in time may not be feasible lah. So I think from our perspective as a research piece, we do not actually have any specific policy recommendations to really advocate. But however, I think the study does face some of these areas as areas of priority. You know, if you want to pay more attention to this area, if you want to pay more attention to areas that will have a greatest impact, actually, then you'll be looking at things like family functioning, looking at things like social inclusion. Yeah, so I think that is where our studies utility is lah. Yeah, and I think may not be fair for us to go beyond that at the moment. Yeah.
Okay, so there's another question here. What could be the reason that children chose to stay at home more instead of outside the house, although their home is a cramped space, aside from personality trait? Yeah, so any views on this?
I'm not sure if our study addresses this specifically, or where their question might come from our study findings that we may have shared. I'm not sure if we have a questionnaire item on whether children are staying at home or outside. Yeah, I'm not sure if we might be able to speculate on this question, or if our study addresses this directly lah.
Yeah, perhaps yeah, so our study doesn't look into these factors. But I'm sure some of the practitioners here who have been working with children and youth for long may have some of your answers to this. So I also might encourage actually at this forum for all of us to just trade some of our knowledge lah. I think feel free to comment on the pigeonhole as well. Yeah. Yeah, so that's something that I would maybe encourage, yeah, as an answer. Yeah.
So I would like to appeal to the attendees here to raise their hands if you have any comment or views that you would like to share besides asking questions. Yeah, any questions? I think it's important to have break time or comments that you would like to make regarding this. Okay, again, I see no hands yet. So maybe I'll just move on to another question here. Okay. Okay, so this one I believe is part of the study. So is there any more insight as to why these two items, receiving and giving help to friends and relying on friends, scored the lowest on QOL facets? Yeah.
Yeah, maybe I can try and take a step at this. Yeah, then of course Becky can add on. I guess yeah, again, we don't really dive deep into this in our study, but I think if I was to offer some speculation, I guess these are actually the aspects that tend to be a bit harder, you know, compared to other facets in the domain. So you know, sometimes, I mean, even for adults, right, you can think about it as it's easy for us to just have a very shallow you know, we're happy with just hanging out with friends and so on. But when we talk about having to seek help from our friends, rely on our friends, that tends to be a higher barrier to clear. Yeah, so I think but that in itself also then is the meat of it, like, you know, at the end of the day, you know, when you need that support, do you really have it? I mean, I think that extends even to children. So you know, are they able to share what they have? Are they able to help each other in homework and so on, you know, beyond just going to school, yeah, play together, recess and so on. I mean, this is my own opinion. But yeah, so it's really about then going deeper to build that peer support, you know, to build that sense of, like, you know, the sense of inclusion and so on among each other lah. Yeah, that would be how I might think about the differences. Yeah.
Yeah, I think Song Hao has made some fair points. I'm just looking at our kid screen domains again. Obviously, there are domains that are going to be the highest, right? And there are domains going to be the lowest, right? And I'm looking at them and just thinking of the opportunities that maybe children and youth have for peer relationships compared to, say, parent relationships or even time spent in school. One reason could be just that children and youth just don't spend that much time with their peers as compared to other areas in their lives. Maybe they're very busy studying or have a lot of things to do at home, right? So one maybe just the lack of time and opportunities, especially for very young children, right? That they may have less independence to go out and spend time with their friends. That time is very much dictated by their parents. So that's one, lack of opportunities, lack of time. Another area maybe we can shed light on, and this is again to push our report out there. If you look at some of the focus group discussion quotes that we've picked out, we see that this is for youth. We see that they cite certain difficulties about relying on their friends, like they learn not to share stuff because they don't want to have the things that they shared or information that they shared being used against them. And they also say that spending time and having support is important to them. So this idea that yes, it's an important part of their lives, but maybe they're having some challenges or having some obstacles. Again, this still points to the fact that more can be done for children and youth in this area, whether it's giving them more opportunities or trying to address some of the obstacles that they have. But it's an important area to them, and even though children and youth locally might spend less time or have relatively fewer opportunities, I think this finding is still important. It tells us that maybe this is an area that we can look into and provide more opportunities, whether as families or as practitioners or as teachers or as just adults in the community, right? Fostering this idea of the importance of friendships, supporting each other, being able to rely on each other. And that's what we really want to achieve for children and youth, right? To enhance their well-being and feel that they are supported by their peers, whether they do have conditions or they don't have conditions. Yeah.
Okay, so just to go back to another the pigeonhole, there's another question is interesting that for children and youth with mental health condition, the service used for therapy and tuition is at the same level, 16.2%. Are there any possible influence of academic stress on their psychological well-being?
Yeah, maybe I start with the question. Yeah, so definitely if I was to think about it, academic stress tends to be a common refrain, right, among children and youth, whether or not we have mental health condition or not. That tends to be an area that children are quite stressed about. And I think if we recall our slide on the token location, where we asked caregivers to actually locate the tokens for improvement. Actually, next to psychological well-being, academic education would then be the next most area to which they actually want to see improvements in. So I think I guess there is some interaction of these effects on mental health. But of course, again, we know mental health is multifaceted. It's not just because someone is stressed, that's why they have a mental condition. Sometimes it's also due to certain genetic predispositions and so on. Yeah, so it's something that I think our study did not really try to get into. But I think these are just some of the responses that we hope can help you understand some of this. Yeah, from our study.
Yeah, agree that we can't address academic stress specifically. But even when we look at some of the school environment items, we address school environment in a very broad sense, like whether they feel happy, whether they feel that they get on well, whether they feel that they can pay attention, and whether they get on well with their teachers. So yeah, even though we don't address academic stress specifically, we do see some deficits in this area for children and youth with mental health conditions compared to their peers without conditions and compared to their peers with other conditions. Yeah.
Okay, there's another questions, but this one I think is it go beyond this study by itself. And the question is whether the QOL measures between the various groups So besides children and youth, compared to people with disability, elderly, which NCSS has done and reported, how where there's question, now I lost that question. Okay, comparable with each other or have a common baseline of measure.
Yeah, I can take a question. Generally, I think across the children and youth in our research, we do having this comparative measure is important, and hence that's the reason why we chose the kid screen that is across children, youth with disabilities and so on. When it comes to comparing across ages, talking about say comparing with say elderly and so on, then some of the domains start to be a bit different. So to that end, actually we do have the we do use another measure when it comes to adults, which is the cold breath measure. And to explain more about differences about this, you will see that just now when I was going through the kid screen measure, right? The domains that are in the kid screen are really more developmentally appropriate for children use. So for instance, they do things like their school, things like their parent relations. In a more do you spend do you feel that you can do the same things like other children, that kind of stuff. But when it comes to adults, right, then there is a bit more focus on things such as their physical environment, satisfaction with say their living environment, which is not that something that you immediately ask the kids. Also includes things like their work capacity, sexual activity, and so on. So I think this is the approach that we have used NCSS in trying to recommend different scales for different audiences. But of course, I think when it comes to adult level, then we also have that focus to say that for adults with conditions, it should also be comparable to adults without conditions. Yeah, so on and so forth. So I mean there'll be more there are actually more details on this you can find on our SEF website that I think we are happy to just share the link later on as well. But I think in terms of then directly comparing children's QOL to that of adult directly, I think that's something that may require further study. Yeah, because I think that fundamentally is maybe, although it's actually the same construct, but it's actually measured in different ways. Yeah, something that we will have to look into more lah. Yeah. Yeah, but I hope that addresses some of your curiosities about it as well.
Okay. Okay, another question was, how does the level of maturity of the individual, that is the child or the youth, influence their perceptions of QOL? I think this relates to the developmental level and yeah.
I think generally our items are worded quite simply and clearly, and this has been tested across children of different cultural contexts and also across different countries and different ages. So because the wording is so simple and so clear, I doubt that there would be significant differences for one particular age group that we like that there would be an effect of maturity. Basically in our analysis, we do group them according to ages, and essentially, the items are very simply and clearly worded.
Okay, one more question is, our programs being reviewed to ensure they are holistic, addressing the various aspects of children well-being. So I think it relates to how whether NCSS role in reviewing programs to ensure that the different aspects of children well-being as reported in QOL studies are being addressed.
Yeah. So actually, when it comes to serving children and youth, right, it is a very large space, right? I mean, children and youth, aside from the social service space, there are other stakeholders like the educational sphere, as well as even when it comes to online behaviors and so on. I think there are different agencies that we do work with. We do have these conversations. So like I mentioned earlier on, we have been sharing some of these findings to actively try to go into where the gaps are as well. Yeah. I think on the ground, even if I just confine the scope to just our social services, each of us serves a different cause. But I think, but I hope that this study does encourage you to also think broader. It may not be actually that your program has to do everything under the sun, but I think just being conscious of it, and maybe being able to say refer a child with similar needs, similar profile, to agencies that actually do tend to such concerns. I think that will also go some way into addressing the QOL of our service users in a more holistic manner. Yeah.
Okay, so now we'll end off with the last questions on Pigeonhole. And that is that I think it's just yeah, it's more questions related to program in general from administered by NCSS. So there are programs in place, but how the public can get to know these resources are actually available to them. Yeah, so maybe that's something that you can do a pitch also.
Yeah, sure. I think that okay, if I could share just one website you can begin to get started with. I think that would be support.goware.gov.sg. That's also where I think during COVID-19 a lot of the support schemes were also uploaded. So I think the government is really trying to make that a one-stop portal for as many help and assistance schemes as possible. So if you are interested to look at some of the resources there, or rather just getting started to know, okay, I actually need help. I have children and youth of what age and what age. Do visit the portal as a start. I think that will give you some of the agency names, some of the schemes and so on, to just begin with on your search. But otherwise, I think another area, especially as we talk about family functioning just now, right? Would be the Families for Life portal. That also includes a lot of different resources about parenting and so on. To look at. Yeah, I think we will definitely be able to share some of those links with those who are looking for such. So we will probably seek SSR's help to disseminate this to the attendees as well.
Just to add on really quickly, another way that you can look for resources is in our public report. So we've actually curated a series of resources that might be useful for children and parents with different types of conditions that we've presented in today's presentation. There's a whole section on the service landscape, the services available, and some helplines and contact numbers. So please feel free to go to our report as well, and we hope that these resources that we've curated are useful for you.
So that's the end of our Q&A sessions, and maybe please join me together to give a clap to the presenters, Becky and Zhong Hao, for their very detailed explanations and their presentations. Thank you very much.
Thank you so much, Zhong Hao and Becky and Lei Hun. So before we wrap up this seminar today, just request everyone to help out with 2 surveys. So first is the poll that I just launched on Zoom. Please tell us what you think about the webinar today. Greatly appreciate your feedback. And just to recap, as mentioned earlier, I will send a follow-up email to everyone, including those who registered but can't attend, containing all the resources that we have mentioned in this webinar. So one more thing to ask is, which is not related to this webinar, but greatly appreciate if everyone can take 5 minutes of your time to complete this second survey, which is by SSR. So we seek to understand the challenges faced by Singapore social service agencies in conducting research. And we also want to find out your training preferences related to research capability development. So SSR hopes to identify how we can better serve your research needs and improve your experience with us through this survey. So really appreciate if everyone could spare about 5 minutes of your time to complete this as well. So thank you again to the speakers, Zhong Hao, Becky, and Lei Hun for moderating this session. I think you have answered most of the questions on Pigeonhole. So I'll leave the screen on here for the participants, but please feel free to leave the Zoom room if you have to. Thank you so much.